My fatigue was so extreme that I would be pushed around in a stroller to school, even when I was in kindergarten or going into the first grade.
When Kate White was 3 years old, she was diagnosed with Gaucher disease, a very rare autosomal recessive disorder.
Gaucher disease is a genetic disease. It's inherited, and it's a deficiency in an enzyme that helps to break down fatty substances in our bodies.
When I was diagnosed with Gaucher, I was surprised. I had never heard of it. My family had never heard of it.
We estimate, based on gene frequencies, we estimate there should be somewhere between 350 and 700 Gaucher patients in Canada.
This is a different world I'm in now than I was 30 years ago when I was first diagnosed. I was just told, there really isn't anything we can do for you. We're just going to monitor you. So go about your life and avoid contact sports. Honestly, that was the advice.
There's one or two things on the burners. So in the next few years, there will probably be 6 or 7 different options for treating Gaucher disease.
Treatment has definitely been a huge stepping stone for me. And there are a lot of patients that don't get diagnosed so young and don't get to kind of live the way that I do.
To help raise awareness about the disease, Kate is on the board of the National Gaucher Foundation.
One of the NGF's most important initiatives at the moment is educating hematologists about Gaucher disease in order to lead to earlier diagnosis for patients and then a better outcome.
If you bleed or bruise easily, have an enlarged spleen, and malignancy has been ruled out, you should be tested for Gaucher disease.
Without early diagnosis, I don't think that my life would look exactly the way that it looks now. I have an active lifestyle. I'm happy and healthy.
My name's Cody, I'm 35 years old. I'm a recovering addict.
Addiction is a disease. It's identifiable, it's chronic, it's progressive, and it's fatal if it's not treated.
People don't understand. And when people don't understand something, that breeds fear, which ultimately puts the people that suffer from these diseases on the fringes.
My first experience with addiction started probably 5 years ago. And I'd gotten an attack of pancreatitis and I was put on prescription pain medication. And there was just one day that I decided to take extra and it kind of took off from there.
On some level, once a substance is put into the system, that person can't reasonably control what they're doing.
The last time that I had gone into the hospital because of the overdose, my mom came in and I could kind of see in her eyes that she'd kind of come to terms that I was an addict and this was probably how I was going to pass.
If we could engage families in the recovery process along with the addict and alcoholic, the recovery rates would increase. They need to move away from enabling the disease of addiction and start to enable the recovery process.
Well, I hit bottom and that's when I ended up here at Brighton.
Brighton Recovery Center was formed by myself and a group of other people that understand that this industry needs quality care. We treat people with dignity and respect.
Ever since I was young, I dealt with anxiety and depression. And in high school, I started experimenting with different drugs and alcohol.
Dual diagnosis treatment is the concept of treating mental health issues and substance use disorder issues at the same time.
It became the center of my world, so I pushed friends and family away. The more that I kept people away, the easier it was to maintain the addiction.
And so this addiction overrides things like love and care for others.
We highly individualize the care. The person comes in, they have an initial assessment with a master's level clinician, decide which kind of therapy modalities they're going to use.
We had group process where we could kind of talk to each other about the things that we were dealing with and was led by a therapist.
When you combine those evidence-based practices with some 12-step philosophy in an environment that promotes healing and dignity, we believe that that's your best option for success. It used to be where we call it the shame game, where you bring the person in, you break them down in order to build them back up.
People who view drug addicts believe that they created this themselves. They're the ones who chose to do the drugs. They're the ones that continue.
In our view, the patient has probably done enough of beating themselves down and needs an environment where they can start building themselves up from where they are. We supply the hope in the beginning until they can take it on themselves and bring it out into the community and hopefully eventually start helping other people themselves.
I think being in recovery has helped me to kind of gain that self-worth back. I was surprised that I was able to not only get sober, but also enjoy life. That was really kind of a scary thing for me. I thought, I could get rid of the drugs, but am I gonna like what I see after? And the truth is you can be sober and clean and have an amazing life, and it's very hard, but it's really worth it.
For more information about addiction, dual diagnosis, and recovery, visit these websites.